Thousands of state retirees are just finding out that their prescription drug coverage is ending in 6 months. WMER2 News' Abby Isaacs has more on why this is happening and what kind of impact it's going to have on retirees. Abby?
Well, all Medicare-eligible state retirees now have to find a new coverage plan that works for them and their families on their limited budget. Some retirees are also looking at their legal options after the state just notified them about the change that they'd been counting on since they first started working for the state.
It's a crime. It's unjust. It's not fair.
Jeffrey Israel and Charles Lewis worked for the state for a combined 77 years.
It was just a real shocker. I just stunned.
Now sharing the same emotions after getting this letter in the mail.
Dear Mr. Lewis, this letter contains important information about the end of prescription drug coverage.
The Department of Budget and Management started sending them out last month, letting roughly 38,000 Medicare-eligible state retirees know that they will no longer get prescription drug coverage with their state health plan come January 1st.
You must enroll in Medicare Part D.
Israel immediately called Medicare. He was worried the price would go up for his prostate cancer medication, and it did.
Humana was $10,000 a year. This is life and death type of stuff. And that's the way will be for other people.
The co-workers from Division of Parole and Probation say the state should honor its commitment to them.
It was just kind of a tradition. You settle for lower pay for better benefits. And these benefits, you assumed, I guess, were going to continue into retirement. And now the state is withdrawing them without really any fair notice.
While it's news to these retirees, it's not new. This transition has been in the works since 2011, when former Governor Martin O'Malley and the Maryland General Assembly enacted comprehensive pension reform. Originally, the coverage would end in July of 2019 to coincide with the federal government's closure of the coverage gap or donut hole under Medicare Part D. When the federal government moved up the date to January 1st, the Maryland General Assembly voted to accelerate the change here too. The Hogan administration and the Department of Budget and Management say they fought to keep the July date. Now they're trying to help ease the transition, but it's not good enough for Israel and Lewis.
Someone needs to take action and step up and say, I'm going to work with you people to maintain this benefit.
Maryland has a senior health insurance program with trained counselors to help in finding the right plan. Retirees have to sign up during Medicare's open season from October 15th to December 7th if they want to keep prescription coverage.